Amputation Nursing Study Guide. 1. What does AKA mean? Answer: above-the-knee amputation. Rationale: AKA stands for above-the-knee amputation. This term is used to describe when a patient's leg is surgically removed above the knee joint. Knowing this helps nurses anticipate specific complications, such as hip contractures, and tailor care accordingly. 2. What does BKA mean? Answer: below-the-knee amputation. Rationale: BKA stands for below-the-knee amputation. It refers to removing the lower part of the leg but keeping the knee joint. Patients with BKA have different rehabilitation needs than those with AKA, especially related to preserving knee movement. 3. To prevent post-op swelling, the stump should be blank for blank to blank hours. Answer: elevated, 12 to 24 hours. Rationale: after an amputation, keeping the stump elevated for 12 to 24 hours reduces swelling and improves healing. Elevation helps blood and fluids drain properly and reduces the risk of pressure buildup. 4. After the first 24 hours, if the patient had an AKA, they should lie blank several times per day. Answer: prone, to prevent flexion contracture. Rationale: lying prone, on the stomach, helps stretch the hip muscles and prevents them from becoming tight. For AKA patients, this reduces the risk of a flexion contracture at the hip. 5. The number one contracture problem in AKA is blank of the blank. Answer: flexion of the hip. Rationale: a contracture is when muscles shorten and joints stiffen, limiting movement. With AKA, the hip is most at risk. Preventing hip contracture is key to helping patients walk again with a prosthetic. 6. What will prevent hip flexion contracture after AKA? Answer: lying prone several times a day. Rationale: encouraging patients to lie on their stomach helps keep the hip muscles from tightening. Doing this regularly maintains joint flexibility and supports better recovery. 7. What is the number one contracture problem after BKA? Answer: flexion of the knee. Rationale: after a BKA, the biggest issue is the knee becoming stuck in a bent position. This makes it harder for patients to use a prosthetic leg later, so nurses focus on keeping the knee straight. 8. How do you prevent flexion contracture of the knee after BKA? Answer: remind the patient to straighten their knee constantly while standing. Rationale: keeping the knee straight while standing trains the muscles and joints to stay in a neutral position. Frequent reminders help the patient build healthy habits and avoid long-term issues. 9. How often should a stump be washed? Answer: daily. Rationale: cleaning the stump every day prevents infection, removes sweat and debris, and allows for skin checks. Daily care is crucial for maintaining hygiene and avoiding complications. 10. When a stump is wrapped, the bandage should be tightest blank and loosest blank. Answer: distally, proximally. Rationale: wrapping the stump tighter at the end, distally, and looser toward the body, proximally, helps reduce swelling and shape the stump correctly for a prosthetic. 11. If after a right BKA, the client carries pain in his right toe, he is experiencing blank. Answer: phantom limb sensation. Rationale: feeling pain in a body part that's no longer there is called phantom limb sensation. It's normal after amputation and happens because the brain still thinks the limb is present. 12. Phantom limb sensation is normal, T/F. Answer: true. Rationale: yes, phantom limb sensation is a normal part of recovery. It happens to many amputees and usually gets better over time. Understanding this helps nurses reassure and educate patients. 13. Will phantom limb sensation subside? Answer: in a few months. Rationale: most patients feel less phantom limb sensation within a few months as their brain adjusts. Knowing this gives patients hope and encourages them to stick with their recovery. 14. Is it acceptable for the patient to push the stump against a wall? Answer: yes, this is one way to toughen a stump so it will not break down due to the wear of the prosthetic leg. Hitting it with pillows is another good method. Rationale: pushing the stump against a wall or hitting it with pillows helps desensitize and toughen the area. This reduces the chance of skin breakdown from prosthetic use.